Good afternoon. My name is Jasmine Cabrera. I'm a resident in HCA Kendall Hospital, and I'm going to talk about my case report titled Chronic Dysphagia, Unveils an Autoimmune Etiology, Importance of Clinical Vigilance in Avoiding Unnecessary Invasive Testing. This is basically a brief case summary highlighting the importance of clinical vigilance when evaluating chronic dysphagia. Dysphagia is a common complaint with a broad differential. In many cases, especially in older adults, it's initially attributed to structural or reflux-related causes, but when symptoms persist despite treatment, we need to dig deeper. Over-reliance on imaging or endoscopy can sometimes delay the correct diagnosis. So for this case, we saw a 65-year-old male with a known history of GERD and progressive dysphagia that hadn't improved despite proton pump inhibitors and lifestyle changes. An earlier endoscopy had showed only mild gastritis, no esophagitis, strictures, or malignancy. However, the symptoms continued. On further evaluation, a more detailed history revealed some important clues. The patient had chronic dry mouth, dry eyes, and long-standing joint pains. Physical exam showed dry mucous membranes and tenderness in multiple joints, though no swelling. Given these findings, we suspected an autoimmune etiology. Lab tests confirmed it, positive anti-SSA and anti-SSB antibodies. The diagnosis was Sjogren's syndrome, and he was referred to rheumatology and started on both symptomatic and disease-modifying therapy with significant improvement in both systemic and esophageal symptoms. For our discussion, we talk about how Sjogren is a systemic autoimmune disorder that's often underdiagnosed, especially when the patients present with vague symptoms like dysphagia. Esophageal dysmotility is a known but under-recognized manifestation caused by lymphocytic infiltration affecting exocrine glands and smooth muscle function. This case really emphasizes the importance of thorough history taking and physical examination. When we rely too much on imaging or endoscopy without considering systemic causes, we risk missing the real diagnosis and exposing patients to unnecessary procedures. For our conclusion, in any patient with persistent dysphagia and no clear structural cause, think beyond the esophagus. Look for signs of systemic disease, especially sicca symptoms or joint pain. This case reminds us that a careful, holistic clinical assessment can be more valuable than a battery of invasive tests.